We are BitcoinMagazine.nl, and we are live from the heart of London right here for the Midnight Summit 2025. And guess what? We've been sitting down with the KOLs, the CEOs, the CFOs, all the people who actually matter not only to crypto, but to the ecosystem that is Midnight. Charles Huskins was just on stage. Fami opened the day. We've been getting information of all the growth. And like all the builders have been saying, we are at the precipice of the future of crypto. And it's happening right here. And at the core of it, Midnight is all about security, privacy, and transparency. And there's no other field where all of those things come into play more than healthcare. So we get to sit with one of Midnight's main healthcare partners right here at the Midnight Summit Event 2025. So you know what to do. Share the video, like the video, leave a comment as we talk with Gem. You ready? I hope you are. Gem, I'm going to shake hands with you in this hand. Since the other hand is full, you're holding the mic.
Of
It's a
course,
little bit loud here today. That's why he's going to hold the mic really close so we can catch everything he says.
for sure.
Gem, healthcare, extremely, now I don't want to use the word dangerous, but it's sensitive. It's a sensitive matter when it comes to the privacy of people, information of people, all the information that you actually travel with in healthcare. If you want to move from one doctor to another, you need to take all the information. And at some point, it is traveling through an open channel from one point to another. So I do understand the need for Midnight. So from your side, start by introducing yourself, but tell me, why was it important for you to be here today? Besides being a partner.
Yeah, there was no way I would have missed this event. I think Midnight and what Charles is doing is extremely important. And his dedication to research and even medical advancements, medical and health tech and healthcare is something that's very near and dear to Charles. And obviously, he has his own clinic, the Hoskinson Health and Wellness Clinic, which is one of our partners as NexiFuse as well. I started my career in educational technology. At the time, it was my intention to democratize access to educational technology and tools to advance technology. Born in South Africa, raised in Europe, currently in North America, I have a lot of segmented medical records. You can imagine that all the things, the treatments and vaccinations that I've received are all in different languages, in different systems. Matter of fact, if I were to go see a doctor today, God forbid, there would be a very small chance that I could accurately relay my entire medical history or my allergies, maybe the medications that I take. So to me, healthcare, medical data is deeply, deeply personal. And there should be nothing more private than your most sensitive medical data. And that's what we set out to do with NexiFuse. As the name insinuates, there's different points of information. Nexi, the hospital, governments, the clinic, urgent care, walk-in, and your data is fragmented across all of them. What we want to do with NexiFuse is we want to fuse together that information so that when you are traveling, or if you move to a brand new country, or if you switch providers of healthcare, that data comes with you, not with a fax or by letter or by phone, but by something much more secure. And that's what Midnight is allowing us to do. We can grant access to your medical records in the most technologically advanced way.
Now, how do you guarantee that my records are secured from the other end? Because obviously, when you're gathering the records, they are from an unsecured source. And when you bring it together into your actual vaults, how do you ensure that the correct record comes in? And not only that, how do you ensure that when it actually goes back out, this is correct information?
That's such a wonderful point, and what an accurate capture of what we're building.
I'm trying.
So we have to do things in phases.
Yeah.
Midnight is in its early days. It's not even fully launched yet. We have a number of institutions across 4 different countries that is experimenting with the technology that we have built. Currently, your medical records are probably at a doctor's office, maybe in paper format, most likely in a digital format. So you are putting your trust in their custodianship of your data. What we offer hospitals is the ability to shut off their existing systems to the rest of the internet. keep that data offline. We know you need it to conduct your day-to-day operations. With NexiFuse, we give them the ability to, as you said, secure that data in a vault. Once it's in a vault, we have 3 different layers of security that protect your anonymity and the security of those medical records.
Okay.
Once you have those medical records and you go to a new provider, maybe you want to give selective access. This is what selective disclosure of midnight promises as well.
This is what midnight is.
Maybe your GP doesn't need to see your mental health notes. Maybe they don't need to see another treatment that you had. So you can selectively disclose which data you want to share. We also provide a very robust framework from the receiving end. But ultimately, at the end of the day, when a medical practitioner or a healthcare institution uses that data in their EHR, we're trusting them to keep that data secure. But with NexiFuse, if they can close off their access to the internet, their plain text database is now not accessible to hackers.
Okay. Now, that last word you said, ransomware at its core targets hospitals as their first go-to.
That's exactly right.
How do you ensure that NexiFuse doesn't become the target now, since if you are removing the access to the internet from the records and you're kind of putting them behind this wall that they don't even have access to because it's not online, how do you prevent them from thinking, okay, since I can't get it that way, we're going to have to hack NexiFuse?
I love it. These are such perfect questions, Emmanuel. So we have seen a few of these countries, like Abu Dhabi, Turkey, the United Kingdom, consolidate their medical infrastructure into a centralized database.
Yeah.
This is what you would call a national medical data center. The thing about something like that, it creates interoperability. Now, different providers can tap into that nexus, but it is also a single point of attack.
Extremely dangerous.
We have seen this happen. A number of these institutions have been hacked. In the United States, which is where I primarily reside, we're seeing major breaches on a weekly basis. 1 million, 2 million, 3 million sensitive medical information that contains financial information as well is leaked. Because the way hospitals use their database is a unified system where it's not fully encrypted. They will have your name. In the US, they'll have your social security number, your address, the name of your children, the credit card on file. All of that gets leaked. And there's not much you can do once that's out the window. Much like what cryptocurrency, blockchain, and Midnight are proposing, we have fully decentralized our infrastructure. So if you do want to hack NexiFuse, you would need to go to each and every point of Nexi that we have. You would need to hack that server. You would need to break the encryption on every single medical record that we have, which is encrypted in a unique way every time. And then once you do those 2 things, which are very hard to do, you would also need to identify who that person is. Because we don't keep your information. We pseudo-anonymize you. And that's what decentralized identification documents allow us to do.
This was not a roadmap or any actual challenge to any hackers out there. Don't go do this.
Please don't do it.
Don't do it. But what you just described, the steps you just described, make it extremely reliable and secure. No problem. How are you dealing with compliance when dealing with this type of sensitive information from him, from me, and from you?
So HIPAA compliance and GDPR compliance, or KVKK in Turkey, is something.
KVG in the Netherlands.
There are so many different acronyms.
Yep.
Our infrastructure is HIPAA and other medical regulatory framework compliant by design. What makes something in non-compliance of HIPAA is if I can leak your private sensitive information in a very easy way.
Okay.
So oftentimes hospitals will have a system where they will give you a 2-factor authentication, and that will be considered HIPAA compliant as well. We go one step further. We pseudo-anonymize you. So your medical records are not identifiable to you. The hackers would need to break the server, break the encryption, and then finally identify who you are. And none of those things are kept in the same place. So we would need to see a very, very coordinated attack just to get your files.
And once they get my files, they don't even know it's my file.
They don't know it's your files. And it would be
Shit.
meaningless. I mean, if you have, blood type and age and there was no name, that is HIPAA compliant because it's not personally identifiable.
Yeah.
But it's also meaningless.
Yeah. You can't put it one. So we talked about security, we talked about compliance. The next point, you know what's coming. How do you make this extremely easy and accessible to everybody, and at what speed?
That is the biggest challenge. Obviously, healthcare has a very, very long sales cycle. Doctors took a very long time transitioning from pen and paper to digital health records. And so we don't want to change what they do. We don't want to change any of the electronic health record systems that they have. And I think that's what gives us an advantageous spot. We want to work with your existing software. And that's what we put at the forefront: interoperability. We go to medical institutions and we tell them you can keep your software, shut off the access to the internet for your centralized database, utilize our Vault technology, and open that to the network. And then we use all the methodologies that I describe to give them more security. So now the friction for uptake is much, much less. And that's what we're seeing. Small governments, clinics, hospital networks, they are more friendly and open to brand new technology if it means they don't have to switch what they have.
That makes a lot of sense. Bringing it back to where we are, the Midnight Summit, moving forward, when it comes to innovation, of all the different announcements you heard today, which one excites you the most and which one links the best when it comes to what NexiFuse is doing?
One thing that we're working on in the back that we probably won't roll out until Midnight is more mature is the idea that you could commercialize your own medical data. Currently, pharmaceutical companies, research companies, insurance companies pay a lot of money to not you to harvest that data about you. With Midnight, what we're allowed to do is say, Emmanuel, you can take this medical record that you feel okay with sharing with the rest of the world. We can fully encrypt that. We can broadcast it to the blockchain. And now pharmaceutical companies can pay you to query your data. And now all of a sudden, you can be compensated on the information that you wish to disclose, as opposed to the current model where your data just gets mined.
To simplify this for everybody looking, if you ever had a stomach ache or headache and you go online and you search for a headache medication, you'll notice that the ads following that will all be about different types of medication. And that's only one of the different industries that this happens to. So what he's saying that from now on, you get paid to see those ads. Just in short. That's very brilliant. That's very brilliant. So how was your experience today with the Midnight Summit?
It's been phenomenal. And, we've been working with the Midnight team for quite some time, and it's just going better and better every day. One thing that, I think really highlights the technology that we're working on, and it's very pertinent. With the rollout of AI and all these different LLMs,
Yes.
we're consulting it whether we like to or not. There is a blemish on my skin. My stomach hurts. And we're talking with these AI models, sharing some intimate details about the conditions we might be experiencing. It is now confirmed that the uptake of AI is the most meaningful and has the most traction in a tangible way in the healthcare sector. Physicians are able to use computer vision to detect anomalies in x-rays and other imaging data, which is hard to discern if you're looking at hundreds of different charts every day. And what NexiFuse allows is a robust and secure framework in which both physicians and patients like ourselves can share data with AI without having to worry whether OpenAI or Anthropic or Gemini has that information on it. Yes. Currently, as you say, if you do a little Google search on any type of medication or headache, you're going to get bombarded on Instagram, TikTok, and your browser.
Yeah.
And that's concerning. I think we're all getting a bit fed up with that. So if, as NexiFuse, we can provide the framework in which you can comfortably seek medical help from your physician or an AI, I think we would have accomplished our mission.
Very simple mission. A mission that is centered around security, is centered around privacy and transparency when we choose to be transparent.
That's exactly right.
Okay. You know something? Most of you people think that we prepare these type of interviews. This was not prepared. I enjoyed and I learned along with you. So everything that he basically just brought, Gem just brought this masterclass in healthcare, security, privacy, and what it is that it means for us to have our private information out there in the internet. Share this video. It is vital that you share it. It is vital that you like it. It is vital that you comment. And you know something? This is the way we keep bringing forward adoption. This is the Midnight Summit event. And then every time I say it, you have to kind of stop a minute and be like, Midnight's having a summit. You know? It's like we've gotten so far that Midnight, with all of its intricacies, has its own summit. So we're very happy to be here in the heart of London. Ladies and gentlemen, we are Bitcoin Magazine on Gem. Thank you very much for this masterclass, and we appreciate you, and we hope to sit down with you at a very soon point where you could give us more information.
I would love to do that. Thank you for having me.
Wonderful. See you all soon.